Hello everyone, this is Chelan Health, and today we are going to discuss a very important topic, and the topic we're going to discuss is about the premarital testing package. For couples who are aspiring to live together, to come together, to get married, or even to date, these are some of the tests that you need to carry out to ensure that you're on the right path. So follow along and watch this video until the end, and you're just 1 minute away from making a mistake. So please listen to the video until the end. So the first and most important one is HIV test. To prevent you from getting infected or infecting your partner, you need to carry out an HIV test to ensure that both of you are safe and you can come together. The second one is a sexually transmitted disease that is kind of neglected these days, but it is syphilis. And syphilis has far more reaching consequences when it comes to couples getting together, reaching far consequences like in causing infertility and the rest. Then we have hepatitis B. Since hepatitis B is sexually transmitted or through body fluids, it can also affect planning to come together. Then we also have a test which is called hepatitis C. You can do it concurrently to just ensure that you're not having it. Then the next point is blood grouping to check for racers compatibility. I'll explain that one in another video. Then we have genetic diseases like sickle cell disease. You can also carry out the sickle cell disease to prevent two carriers coming together and giving birth to a sickler. Another test is the fertility test. We have the semen analysis for men and then the hormone test for women. I'll explain the hormone test for women in a longer video about all the 5 most important hormones plus one hormones that are supposed to be tested. Then we have other sexually transmitted diseases like gonorrhea, urine analysis to check for any presence of urinary tract infection. Then we have also the HPV test. You can also carry out the HPV test. We also have chlamydia. These are kind of neglected diseases, but they have an impact on couples planning to come together. Then you can also do the thyroid function test. This is very important for women intending to give birth. Then we also have, you can also do an HCG. No one really wants to get married to someone who's already pregnant, and if she's already pregnant, then you can do the DNA fetal test. Then we also have disease testing for diabetes and hypertension. All these diseases can affect couples coming together. With all that information, I hope you have a summary of the list of the packages that you need to carry out before you can get engaged with someone. Now, there is one important point, and that is doing a mental health checkup on your partner. The New Vision released an article on 13th of May 2022 indicating that 14 million Ugandans are suffering from mental health illnesses. 14 million Ugandans suffering from mental health illness translates to 31% of the total population. And that means that 3 out of 10 individuals are having mental health illnesses. It is paramount and important that this person you intend to spend the rest of your life with, you take this person to a psychiatrist and you do a mental health checkup. It is for your own good and for the good of the nation. Thank you so much for keeping and watching this video to the end. I implore you to subscribe, like, and comment, and turn on notifications so that next time when we upload another important video, you can be able to receive. And please follow Chelan Health.